Well, good morning, everyone. Welcome to another edition of Weekly Wellness. It's your girl, Comedienne Joy, and I'm excited to be here with the wonderful, illustrious Dr. Mia of Me Bella Wellness, and we're gonna be talking about some diabetes. So y'all gonna put them Fruit Loops down this morning and listen to us. Good morning, Dr. Mia.
Good morning, Comedienne Joy. How are you doing this wonderful Saturday morning?
Listen, I am here by God's grace,
Grace,
literally,
grace
because
and mercy, girl.
yes, it's been an amazing week, but Joy is on low power. But hey, we gonna do what we got to do. But if I didn't come and see you this week to get a boost on my pellet, I promise you I would be
You
laid
wouldn't
out
have made
flat.
it. You wouldn't have made it.
No, not at all. I wouldn't have been Marvin Sapp at all. It would have been on mute. I couldn't have made it.
Never would have made it.
Never, never. So
What?
it's been it's been awesome. So obviously you specialize in women and men's health, excuse me, gynecological health, and also intimacy. But today we're gonna be talking about something that we probably normally wouldn't come to you for, and we're talking about diabetes because we are,
Diabetic.
yeah, diabetical issues because we're seeing a rise in diabetes. So
Yeah.
you want to go ahead and do your introduction, and let's jump into this. Why they making them pancakes?
Right. Let's jump into it, y'all. So most of you know, but I'm Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer gynecology to women and adolescents, as well as total wellness solutions for men and women. Our goal is to help you live well so you can age well and experience everlasting intimacy. So yes, Comedienne Joy, today we're talking about type 2 diabetes, and I thought this was an important conversation to have. One, because the rates of diabetes are definitely rising, and not only in the adult population, but unfortunately also in the child obesity category and with our children. So we're starting to see people get diabetes at a much earlier age, and therefore the chronic diseases associated with diabetes and the chronic downline risk associated with diabetes are starting at a much earlier age, which over time is going to definitely affect our life expectancy. So now this is the first generation of children who may not outlive the life expectancy of their parents. And a lot of that has to do with our lifestyles, our diet, our exercise, and the lack of living a healthy lifestyle.
So that means put down those fruity pebbles, those Fruit Loops. Let's talk about what a healthy breakfast should look like, and one that we can all embrace because we are creatures of the jams, the jellies. And even as I do my food tours, I have a number of people that when they want wine, they only want the sweet wines and the Moscatos.
Mm-hmm.
I personally am all over the place. I have a wide palate. So yesterday I tried a new Moscato. I
Mm.
thought was sweet enough. That was like, it still ain't sweet. I'm thinking I'm gonna start serving a bag of sugar and put
Right.
it in a glass.
Right. So yeah, definitely alcohol plays a huge role for the person with diabetes or pre-diabetes. So pre-diabetes is when the hemoglobin A1C is not quite in the diabetic range, but it's abnormal. So we say a hemoglobin A1C, which is the test that we use to test and see if you have diabetes. We do that, and sometimes do a fasting glucose. But when the hemoglobin A1C is over 5.6, we say you have what we call pre-diabetes. Once that hemoglobin A1C gets to, I think they say 6.5 now, but I don't really treat pre-diabetes any differently from diabetes, because the real answer is that this is totally curable. So if you have pre-diabetes or type 2 diabetes, you can be cured from that simply by losing weight, changing your lifestyle, changing your diet, eating a breakfast full of healthy protein and fiber, and decreasing the sugars and the carbs in your diet in general. So instead of having a breakfast with biscuits, grits, eggs, and bacon, considering on 80 to 90% of the time having the eggs and the bacon, but not necessarily putting the bread into the diet. Some people who just have to have bread like me, I'll do a lot more sourdough bread and I do less of it. And the other thing I say is not having a carb with every single meal. And when I think of a carbohydrate, I think of rice, bread, pasta, potatoes. So a better way to eat those things are, instead of eating white bread, white pasta, white potatoes, is to do brown stuff. So you want brown. Brown is better. Okay. So
So
brown.
it's brown when it's fried. Like fried rice. That is
No,
that
no,
that's
no,
brown.
not that brown. The brown rice that does not have the extra enriched flour and extra enriched anything. So you want to find the wheat pasta, the brown rice, the wheat bread, and the sweet potato, and replace all of those white things. And that's going to have a better glycemic index. So when you're talking about diabetes, you're talking about the fact that when you eat sugar and carbs, if you're pre-diabetic or diabetic or just insulin resistant, when you eat sugars and carbs, your insulin levels go way high to control your blood sugars. And even though they may be controlling your blood sugars with prediabetes or with insulin resistance, it's still increasing the amount of insulin that you release in order to control the blood sugars. And when that happens, that can cause all those other negative symptoms associated with diabetes, which that knocks the hormone levels off. That can cause more acne, more facial hair, more thinning of the hair, gaining weight in the belly. All of those things are caused by high insulin levels, which can also negatively affect hormones. And for some women, that can cause PCOS symptoms, which is basically insulin resistance with abnormal cycles, meaning a lot of those women, because of the high insulin levels, when they're eating the sugars and the carbs, they put out more insulin to control their blood sugar, but that extra insulin knocks everything else off. And those are the negative side effects that you can get from having too high insulin levels: the big belly, the increased acne, the increased facial hair, the thinning of the hair, the difficulty losing weight. And the big deal about type 2 diabetes, and what frustrates me most with my patients, is that when they know they have it, they still continue to drink sodas and they still eat all the carbs and they don't care about their diet. They're not exercising. They're not trying to lose the weight. And that's the beginning of the disease. The end stages of the disease can negatively affect the heart, cause heart disease, stroke. It can cause you to have amputations because of lack of blood flow, because of all the blood sugar that's in your system. And it can also cause death, kidney disease, amputation. So diabetes is a very serious disease that a lot of people don't take as seriously as they should, and it's negatively affecting their health, and it's decreasing the life expectancy of us in this United States population. And it's simply because of lifestyle. The change of lifestyle can completely get rid of diabetes. I have many patients who come to me with the elevated hemoglobin A1C or having full-blown diabetes, and they lose 10% of their weight. Their hemoglobin A1C goes back to normal. They get down to a normal weight. They maintain their own healthy blood sugars. They're not releasing all of that insulin. Their cycles are regular, and they're not having all of those negative side effects that are started by high blood sugars, insulin resistance, and type 2 diabetes.
So, are there any pre-diabetical signs for someone who, may not even be aware that, hey, my body is going through this change, or this is what my body's doing? Because the younger we keep getting, your body starts to do weird stuff.
That's a good question. So a lot of times it's not. So, initially pre-diabetes is kind of like hypertension. You don't know you have it until you're screened for it. So that means that if you have a family, especially if you have a family history of diabetes, then you should be screened for diabetes. And that should start at an early age. Anybody that's obese with a BMI of greater than 30 should be screened for diabetes. If you know you have that family history of diabetes, your parents had diabetes, your siblings have diabetes, especially those women who know that they have had gestational diabetes, meaning when they were pregnant, they had diabetes during the pregnancy. Those women are at increased risk of having diabetes. But simply having that family history, simply noticing some of those other signs and symptoms that I talked about, like the increased acne, the thinning of the hair. A lot of people think that that has something to do with hormones, and it does, but it's the initial hormone of high insulin levels that knocks our other hormones off and causes us to have a lot of those other side effects, like the thinning of the hair, because of the extra androgens that are floating around because of the high insulin levels. So, but the thing is, the craziest thing is that this is the most preventable disease. This is a disease that's easily cured with weight loss. A lot of my patients can lose just 10% of their body weight. So they come in at 250 pounds, they get down to 25 pounds. We're going to notice their hemoglobin A1C getting better. If they can continue to lose the weight and try to get closer to a normal weight, they're going to notice that their blood sugars look better, their hemoglobin A1C is better. But the problem is when you don't do that and you walk around with diabetes, you're at increased risk of high cholesterol. It's like metabolic syndrome. So those people who have increased risk of diabetes with insulin resistance are also at increased risk of heart disease, high cholesterol, strokes, and then, like I said before, kidney disease. So a lot of people who are on dialysis is not necessarily always because of high blood pressure that's uncontrolled. It's also because of uncontrolled blood sugars associated with diabetes.
So you also mentioned about drinking sodas. What about those Diet Cokes or those zero, no calories, the no sugar, the sparkling water? What
Mhm.
about those things?
So what I tell people to do is to focus on just really drinking plain old water. Like, water is healthy. You don't have to have anything in it. And when you have those sugar-free substances in it, like Crystal Light or some of the other things that have what we call zero sugar, but it's still got the fake sugar in it. The problem with that is that still affects your glycemic index, meaning when you eat white sugar compared to having agave, it's got the glycemic index is increased, so your insulin levels are going to be more disturbed. So doing the fake sugars is not any better because they still have a high glycemic index, which can affect your sugar levels as well as your insulin levels. And remember, with type 2 diabetes, we're more concerned about those high insulin levels that cause all of these negative side effects and the other chronic diseases associated with diabetes.
So you mean I'm not supposed to have Splenda with my coffee?
No, you really aren't. And I used to drink a lot of Splenda, and it's not even just because of the blood sugar. It's also because a lot of these fake sweeteners have some fake stuff in it that have been linked to other things, like an increase in cancer and a lot of the other things that we're seeing more of as far as chronic disease. And a lot of these diseases that we're seeing are associated with our foods and how our foods are being processed and all of these man-made materials that we're not eating. So what I tell people to do is, if you have a sweet tooth like me, I've always been the kind of person, my coffee was always like this color. So it had a
Yes.
lot of cream in it. I would put a lot of sugar in it. And so I stopped doing that. I stopped drinking coffee in general and changed it over to tea. Yes, honey and coffee. Good job, Tina. Honey
Honey
and
and
coffee.
coffee?
Yes, you know what is even better? Agave. So agave has the lowest glycemic index. Honey has a low glycemic index. And there's some other sugars out there. But the white sugar is what you want to avoid. A lot of sugar is what you want to avoid. So you want to pay attention to portion size. Cokes and juices, all of those things have a lot of sugar in them. And if you're already insulin resistant, it is affecting your blood sugars negatively and increasing your risk of all of the bad stuff that comes along with type 2 diabetes.
Okay, so what about juicing? I know during COVID, I got a lot of fresh produce and I was literally juicing. And I think I posted it somewhere because I was making carrot juice. And someone was like, oh, that has a lot of sugar in it. It's like carrot, I thought was a vegetable.
Yeah, it is. And it may have sugar, but it's healthier sugar than the sugar that you can drink from a Coke or the sugar that you would get from carrot juice on the shelf in the store. So it is better to juice. I'm not saying you can't have any sugar. You just want the healthier sugars with less glycemic index, and that is going to be in your fruits and vegetables. But you have to be careful if you have type 2 diabetes, if you're pre-diabetic. Even eating a lot of grapes and bananas, all of those things are still going to negatively affect your blood sugar and your insulin levels, which aren't good. So you have to do things in moderation. Now, having grapes and a half a banana would be better than having cookies and ice cream. But you still want to limit carbohydrates, especially the white stuff. You still want to limit anything that's high in sugar. And if you already have type 2 diabetes, you should be avoiding sugar, juices, and sodas.
All right, so what about this? So I heard back in the day, and I don't know if this is a wise tale or if this is really a medical thing, that I guess if you having like a diabetic attack or whatever, you need to drink orange juice with peppermint. Something about juice, drinking
Yeah.
orange juice.
So that's when you're talking about people who may be already on insulin. And so they took their insulin, but they didn't eat enough. And the other thing that could cause those hypoglycemic episodes where your blood sugar drops is if you're just insulin resistant, you're not even diabetic yet, or you have type 2 diabetes in the early stages. When you eat sugars and carbs, your insulin levels are really high, so they drop your blood sugar really fast, and that's when those people can start feeling, tired and listless and sweating, and that's a hypoglycemic episode in people who may not even have type 2 diabetes, but it's caused by high sugar foods that eventually increase the insulin level. So with the high insulin levels, that quickly drops the sugar. But the best way to treat that is not is with diet. So it's with changing the diet, not eating all the simple sugars, decreasing the sugars in your diet. But when you see that your blood sugar is going low, what I would tell my patients when I did do OB and I took care of gestational diabetics is I would say drink something like milk. Don't drink something that has a whole bunch of sugar in it. Of course, unless your blood sugar is so low that you need to quickly get it up. But you shouldn't have that happening a lot if you're eating a healthy diet. So you still need to decrease the sugars and carbs because they negatively affect your insulin levels and drop your sugar so you feel bad. So now your blood sugars are going up and down, up and down, up and down. And then you got a whole bunch of blood sugar just floating around in your bloodstream, and that's what causes all of the end stage disease, like the kidney disease, the peripheral vascular disease that causes the amputations, the neuropathies where there's numbness in the extremities because of decreased blood flow. Because once you have all that blood sugar floating around and it's not being controlled, it's going to clog up your arteries and everything, and then that leads to heart disease, strokes, and all of the bad chronic diseases that we want to avoid, and we can avoid by changing our lifestyle and our diet.
So we don't want to be eating crazy stuff and saying, "Oh, we got the sugar."
Right. You may have it, but it's something you can get rid of. And just saying that you're going to be good with diabetes or type 2 diabetes is very selfish to you, yourself, and your family.
And we ain't talking about exercise as in just walking to the refrigerator. We talking about a nice brisk walk to get that heart rate up. Walking is free.
Yeah, it's free. You can go outside and walk. And exercise in general is going to help control those insulin levels, which will definitely help with the disease process of type 2 diabetes, insulin resistance, and pre-diabetes. So again, all of these things are totally curable. It requires diet change. So a healthy diet would be, like I said, focusing more on your lean protein, your healthy fiber. And if you're going to eat carbs, doing more complex carbs like the brown stuff that I talked about. And you don't have to take fat out of your diet because you're diabetic. A lot of times when you get low fat foods, they replace the fat with sugar to make them taste good. So that's not a good idea for somebody who is insulin resistant. You want to decrease the amount of sugar, especially simple sugars in your diet. Fruits and vegetables are fine, but even as a diabetic, you want to limit the amount of fruit that you're eating, and you still want to do more complex carbohydrates. And when you're choosing your fruit, you may not want to eat a lot of banana because it has naturally more sugar in it. So you may instead want to eat more like green apples. You can do a few grapes, but there's so many other fruits out there that you could eat. And I do like the idea of juicing. That's how I get my vegetables in. I just don't put a lot of high sugar fruits into my juice so that I can keep them healthy. But that's not the bad juice. The bad juice is the one you get off the shelf where they add all the sugar into it. And everybody's like, I don't drink sodas. I just drink juice. I'm like, well, it's the same thing. You're still drinking sugar. So the problem is drinking a lot of sugar that's going to affect your insulin levels, cause you to be insulin resistant, and increase your risk of type 2 diabetes. And you can get type 2 diabetes even if you're not genetically predisposed, meaning if you don't have a family history of diabetes, you can have such a lifestyle that you increase your insulin resistance and you still can get type 2 diabetes from a terrible diet with high insulin levels and insulin resistance because you're eating too much sugar in general.
So this is November, and Mariah Carey is about to come out this week, and you telling us not to eat all this sugar when we didn't already talk to our auntie. We know Big Mama gonna be making this red velvet, this German chocolate cake. We gonna have these pies. Sock it to me.
Girl, yeah, because it's November. It's like Thanksgiving. What?
Right. So how you gonna tell us when the table gonna be set, don't be eating that? So you want us to eat broccoli salad for Thanksgiving, some Brussels sprouts and turkey?
But you know what? Thanksgiving is one day. One day is not gonna kill your health forever. Okay. However, some things that you can do if you already are insulin resistant, you already have type 2 diabetes, you're already pre-diabetic, is what I do on holidays is I don't plan on gaining weight. I am finally like at my weight that I should be at. I'm at a healthy weight. You know, we always want to lose 5 more pounds if we can, but I don't plan on the holidays causing me to gain weight, because this is the time of the most weight gain of the year, between Halloween, which we just finished, and y'all still got all that candy from Halloween that y'all still eating on. You're stealing your children's candy and all the things, all the way through Valentine's Day. That's when people gain the most weight. So in Me Bella, what we really started doing towards this time of year is really focusing in on healthy lifestyle, how to lose the weight that you already need to lose before the holidays are completely here. And then during the holidays, how to still be healthy, how to still make healthy choices and not gain a lot of weight during that time, because of course that increases your risk of chronic disease and death. So we want to do everything we can to decrease our risk. So even on Thanksgiving, what I do is, am I going to eat some macaroni and cheese that my husband cooks, because he cooks the best macaroni and cheese in the whole wide world?
I never knew about that.
Yes, girl. He is known for his macaroni and cheese. Everybody knows about Joseph's macaroni and cheese. But am I going to eat some? Yeah, but I'm not going to have this much on my plate. On my plate, I'm going to put a whole bunch of greens. I'm going to make sure I get me some turkey. And so I'm going to put more of the healthier options on my plate. We're probably going to have some carrot salad, because my aunt is down here for that. My aunt and my mother-in-law moved here. So we're going to have a combined Thanksgiving from the Milwaukee people and the Birmingham people. We're still going to have our cakes, but I try to fill up on healthier foods. I try to get up on Thanksgiving and work out. There are always a lot of runs and walks on Thanksgiving morning. So that's a good way to kind of get your day started. You already know you're going to eat crazy for Thanksgiving dinner. All right, I'm gonna say you a plate, Tina. You already know you're gonna eat crazy for Thanksgiving, so prepare. We got 3 weeks before Thanksgiving, 3 to 4 weeks, because it's at the very end of the month. So things that we can be doing now: eating our breakfast within the first hour of waking up, decreasing the sugars and carbs in our diets. You know, for breakfast, a lot of times I'll drink a protein shake. It's easy. I can get my breakfast in. Does it taste good? No, it doesn't taste good. But does it give me the nutrition I need to be full? It absolutely does. Decreasing the carbs in your diet for lunch and dinner. Eating your frequent small meals and focusing again on the lean protein, on the healthy fat, and getting that healthy fiber in, and minimizing your carbs. And again, if you're eating carbs, doing the more complex carbs. Increasing your exercise during this time of year. It's not too hot outside if you're in Alabama. It's a good time for you to start your exercise routine. If you have a dog, it'll be easy for you to take your dog for a walk first thing in the morning and in the evening, and to consciously try to move more and just be more active. This is great hiking season, and so many other fun activities that you can do to get your exercise in. If you don't know how to exercise, go ahead and get your trainer, invest in a trainer. Invest in healthy foods. You know, right now, again, we can eat a healthy diet. It's not the holidays yet. We can work on doing the things that we know we should be doing right now, and then count the holidays as one day. Thanksgiving, you get to enjoy your dinner for Thanksgiving with your family. It's a time where a lot of us bond, and it's a really important time with family. But for breakfast, you can still eat light that morning. You know, so I usually wake up in the morning, try to get my exercise in, eat something light for breakfast. Probably 2 to 3 hours later, my mother-in-law is going to make a quiche. I'm going to eat me some quiche, but I'm not going to eat a half a quiche. I'm going to eat me a small piece of quiche. I'm going to monitor my portions. I'm going to make sure I'm drinking plenty of water before each meal so that I don't overeat. And then don't overeat. Stop eating when you're full. Like, your body tells you when you're done. Don't continue to eat just because it tastes good and it's food that you don't get all the time. Minimize your portions. Eat more of the healthy stuff. Make sure y'all have some salads and some greens and some other things, green beans, things that are healthier, so that you do have still the healthy options, even though you're going to enjoy some of the traditional options that aren't quite as healthy.
But not the green bean casserole. We don't want that.
Not the green bean casserole. But you know, you can make a healthy green bean casserole. Weight Watchers has an amazing recipe. I'm just playing. I used to try to do that for Thanksgiving when I first moved back. I was like, I'll make the They're like, we do not want your healthy food for Thanksgiving. So again, I'm not, Thanksgiving, Christmas, these are times when we're with family. We're going to enjoy each other, and we're going to enjoy good food. It's a part of our culture. But we can do things in moderation. And there's so many great medications out there to help with weight management right now that actually are really great for pre-diabetic patients and type 2 diabetes patients. I think the main thing is knowing how to lose the weight, keep the weight off and developing healthy habits, regardless of what health aids you use to help you get that weight off, so you can decrease your risk of chronic disease. And so you can live well, age well, and experience everlasting intimacy. Because guess what? Diabetes negatively affects intimacy. For men, it causes more erectile dissatisfaction. For women, it causes less sensitivity, causes more vaginal dryness, and it causes what we call anorgasmia. It's difficult to have an orgasm when your blood sugars are all over the place and super high. You don't function as well. So
You
it
can't
is
see you up there sweating, you shaking in convulsions. That's just
right.
too much happening right there.
It's
You
too much
cannot be
going
having no
on.
episode.
When all you got to do is love yourself enough to invest in your health by changing your diet, exercising more, choosing healthier options, and then investing in yourself to get help. If you don't know how to lose the weight to improve your health, of course, at Me Bella Wellness Center, we can definitely help you do that. So we'll be talking all month long about things you can do to get through the holidays in a healthy way, improving your health and not going into the beginning of the year like you came into the beginning of this year. This year, I'm going to go into the beginning of the year in a healthy mode. I'm going to be a healthy weight, and I'm going to be working on that throughout the holidays. And I think we all can do that. We owe it to ourselves. We owe it to our families to live our best and healthiest lives so that we can accomplish all the things we were put here on earth to do. And we cannot do that without health. So you have to invest in your health, and you have to do those healthy things like exercise, eat a healthy diet, monitor your weight, go to the doctor, control your blood sugars. If you already have diabetes, making those lifestyle changes, taking your medications. And then remember, that also goes along with high blood pressure. So obesity increases the risk of cancer. It increases the risk of so many other diseases, including diabetes and heart disease and all the things. So we need to do our part, love ourselves enough to invest in our health and do the things we can do to live our best lives, which includes a healthy lifestyle.
Sounds great. So you mentioned that Me Bella Wellness can help people do that. How can they reach Me Bella Wellness?
So they can go to mebellawellness.com and they can schedule their appointment right online. They can follow us on all the different social media handles. I'm always putting out great information to educate the community. That's my goal, is to decrease the health disparities experienced by Black people and brown people in the United States of America. So my goal is to give you the education and the information you need so you can live your best life, and also to send you to good doctors that take good care of all patients. So we can do our part by changing lifestyle. Diabetes is a real disease that increases the risk of early death, and we're seeing it more in our children. And it's our responsibility as parents to set the example and teach our children how to live a healthy lifestyle so that they can grow up to be healthy adults.
Awesome. And if you want someone to clog up your arteries, that's where you call me, and I'll put you on the party bus, and it's only for 4 hours.
Just 4 hours, so you can plan for it. Just eat light during the day, go enjoy that party bus, eat and drink and ride and have a great time.
Exactly. If you need to unwind, I also can book your wonderful vacation, which I hopefully by now you all have planned your Thanksgiving vacation or Christmas, because inventory is getting low. But again, if you haven't, reach out to me, comedianjoy.com, and I got you.
She got y'all. Y'all better holler at Comedienne Joy. She has the best, the very best eat, drink, and ride tours. She sets us some good trips, and she's a lot of fun. She gonna make sure you enjoy your best life and some good food in the meantime. But That's 1 4-hour part of a day. That's not every single day. So everything in moderation. But hey, y'all, don't forget, we got Asia's Intimacy on tomorrow night at 8:30, where we'll be talking about intimacy and diabetes. We also have our anniversary. Guess whose birthday it was yesterday? Me Bella, my third child.
Yes.
3 children, Jamil, Marley, and now Me Bella. So
Yes.
her birthday made her 14 years old on yesterday. So we'll be having a wonderful virtual celebration this year. Next year, it's going to be the big shindig. So y'all get ready for that. For 15 years, it's going to be in person and off the chains. But this year, we're going to do it virtually, because our goal is to let you know how much we appreciate y'all supporting Me Bella over these last 14 years. Remember, I started Me Bella with 0 patients, and now we have thousands of patients because of my wonderful wonderful patients who refer other patients. But we want you to enjoy our virtual event. You'll get to meet the other providers at the practice. You'll talk to my executive team. We'll talk about the history of Me Bella and how much we appreciate our wonderful patients. And of course, it's the biggest sale of the year is November at Me Bella. So we're going to have the best specials, prizes, and we're launching some other new things, including our referral program. Y'all, I've been promising it. I've been telling y'all how much we appreciate your referrals. Well, now we're going to have a program so that you can reap the benefits of your referrals through lots of rewards and savings on our cash services. So we're excited about what's to come over this next year, and we couldn't have done it without the amazing ageless bells and bows that come to Me Bella and allow me to take great care of them with my amazing team. So I'll see y'all on tomorrow at 8:30 p.m. Central Standard Time, same place, November 7th. Go ahead and sign up for our anniversary event. Is going to be virtual at 7 p.m. Central Standard Time. It's going to be informative, great information, and you get those wonderful deals while they last. And we'll be giving away prizes at the virtual event, but you have to be at the event in order to reap the benefits of those prizes. And you're going to get extra specials for coming to the actual webinar to join us for our celebration.
And don't forget Tuesday to go register to vote if you already have.
Don't register to vote Tuesday. Y'all need to be registered so you can go vote. I'm not telling you how to vote. I'm just saying vote for your life and vote for your children's lives.
Well, I'll tell them how to vote. Vote blue down the whole ballot. I've already voted absentee. I did that week before last. So I'm telling you, because I won't be here. So I made it a priority because our ancestors gave their life for our right to choose. So don't be stupid.
And women, don't allow them to take your rights away. They're already doing it. You better go vote, because if the vote doesn't go the right way, we will not have any rights. We don't even know if we'll have contraception. We've already lost the right to decide and to have choice on our own bodies, and we're going to give even more of that up. So y'all need to take the time and go vote. Go vote. If you don't want to vote for yourself, vote for your children. Vote for your daughters and your granddaughters who are to come, and your great-granddaughters, because again, they are putting us back where we were 50, 60, 70, 80 years ago, where we cannot control our own bodies. And that should be important to everybody, not even mentioning the racial things that will happen if this vote doesn't go the right way. So go vote, go do your part. You can't complain if you don't do your part.
Exactly. Vote. So don't get on my bus if you don't vote. Okay, now that's a lie.
And my staff don't even come to work until after you vote. Don't come into my office until you voted.
Exactly. All of that.
Look, and the people that vote, I'm going to get them something special in my office, because I can't make y'all vote. I can't punish you for not voting, but I sure can give you something extra for voting. So y'all got to go vote. Go vote. Your life depends on it. Your children's lives depend on it. Your Black sons' lives depend on it. Your daughter's lives depend on it. Your life depends on you voting in this election. So go vote.
Exactly. So we're going to end on that note. We hope you have a great rest of the day. And don't forget to tune in for tomorrow for
Ageless Intimacy with Dr. Mia and Joseph. So that's for the men and the women. We'll be talking to both of y'all. All right, y'all go live well, age well, and experience everlasting intimacy. Thank you so much for spending your Saturday morning with me. And thank you, Comedienne Joy. Go eat, drink, and ride, y'all. Call Comedienne Joy for your holiday events. We always do a holiday party with Comedienne Joy, too. We got to figure out what we're doing this year. But you don't want to miss that bus tour. It's a great way to celebrate during the holidays.
And y'all better hurry up, because dates are filling up. So
dates filling up, and the trips are going away. Everybody wants to take that holiday trip. Y'all better call Comedienne Joy so you can get that.
Exactly. Y'all have a great day. We'll see you soon.
Bye.